just about every kid gets teased about his or her looks sometimes, but physical abnormalities and the taunts they generate can scar some children for life.
In today's parenting segment, CNN's Pat Etheridge reports on one doctor who may call himself a cosmetic surgeon, but what he really does is mend broken hearts.
Mike Lodicio enjoys rap music, riding his bike, and roughhousing with friends. By all indications, he's a happy, well-adjusted 11-year-old. But that's a recent change. From an early age, Mike was taunted and teased.
Everybody just used to make fun of me.
Why?
Because I had big ears and they stuck out like this. And everybody just used to make fun of me, and I got me really upset and mad. Well, they would say the ears hanging low like Mike Lodicio. They call me monkey ears, call me Dumbo, call me elephant ears and stuff like that.
It was an agonizing experience for Mike and his parents.
Buckets of tears were cried over that. It's just that, you know, I would not wish that on anyone. It was just terrible. There's nothing that you could do about it. You can't be there and you can't fight all your children's battles.
The family turned to Dr. Fredrick Lukash, a plastic surgeon whose specialty is kids.
I'm not advocating taking a girl and liposucking her thighs out so she can be a cheerleader. That is clearly not what we're about.
In Mike's case, the surgery to correct his protruding ears was far more than cosmetic.
My surgery is quality of life surgery, and whether it is a child with a cleft lip or an adolescent with asymmetrical breasts, each problem is of equal importance to that individual.
9-year-old Jeff Brown has been one of Dr. Lukash's patients since birth.
Well, when I was born, I had cleft lip, which is one right around here. The lip is sort of split open, so it's like a fourth here of the lip and a fourth here of the lip, but then half is missing inside here.
This is what Jeff looked like as a baby. After a series of surgeries, the latest just last month, today his scars are barely visible.
Operating on hundreds of children over the years, Dr. Lukash made a discovery. He found he could help heal his young patients, not only through the world of medicine, but through the world of art.
Dr. Lukash helps youngsters work through their concerns and fears by encouraging them to draw.
Is this a cloud?
Yeah, rain cloud.
Oh, I see. It's raining because you're sad? Mm-hmm. Oh, and now the sun is out? Mm-hmm. Oh, okay. Well, that about sums it up.
He's collected dozens of drawings, and last fall, the works went on display at the Long Island Children's Museum.
By getting them to draw, it brings out the feelings that they have, and it also lets their parents begin to understand some of the anxieties, worries, angsts that they have.
There are striking differences in the drawings done before the surgeries, then after the wounds heal.
This is the before. She's obviously going to have some surgery. It's very dark, it's very Frankensteinish. There's a monster coming to operate on her. But afterwards, the sun is shining, she's got a smile on her face, and Frankenstein is turned into a superhero. They reveal anxiety, worry, fear, low self-esteem on the before pictures, and then afterwards there's a sense of relief, freedom, joy, and we frequently will see in the drawings an expression that will say, I'm free at last, or something that relates to freedom.
Mike Lodicio knows that freedom firsthand.
I feel better about myself. I feel like I started from the beginning again.
A fresh start and a lifelong difference for children born looking